welcome everyone. Thank you so much for coming to our Mind and Body workshop presentation. Today we will be having Miss Brandy North and Miss Blessy Koss giving this presentation and the workshop for you guys. So make sure you listen. All of this is great to know, not just for women and for men as well. So thank you so much.
Okay. Hi. I'm Blessy Koss, like she mentioned. I'm a licensed mental health counselor here on campus. And with me today, Brandy North.
Hello.
She is here with us from RGH Women's Clinic, and she so graciously agreed to do this presentation because I was like, when Janiyah reached out to me and asked me about wanting a presentation for Women's History Month and about emotional well-being, I was like, as a woman, sometimes we don't understand how our body, our menstrual cycle sometimes influences our mood, right? I have so many times, and I was mentioning that to Brandy, many times I have clients come in who are women and they're like, I was fine last week. I mean, like, what happened this week? Like, I'm all depressed and my mood is all, like, I'm having mood swings. And so sometimes I have to bring in the conversation of like, okay, where are you at in your cycle, right? And so understanding your body, like, is the best way to understand how it can influence your mood. And like if you have any pre-existing like mental disorders, like sometimes that it can affect that too or exacerbate some of those symptoms. So we're going to talk a little bit about that today. All right. Yeah. And so yeah. Do you ever start your period and think, well, that explains a lot? Like after you snapped at someone yesterday and you're like, or you had a breakdown, a crash out. And then you're like, what happened? And then the next day you're like, oh, yeah, that's what's happening. All right. So we'll be talking about the medical perspective, which Brandy will be guiding us through. And then we have the mental health perspective, which I will talk a little bit about the brain and stuff. All right. So I'm going to let Brandy take it away.
Okay. I really, the basis from where I start is, I think, because I get to see a lot of people just throughout the lifespan, but especially in our younger years, I feel like, and I say all the time to my patients, which is knowledge is power, right? The more we know, the more we can rationalize what is confusing, what is scary, what I should talk myself down off the ledge of anxiety, right? Because if you know, then you're like, oh, I don't have to be scared about that. Mm-hmm. So knowledge is power. And so we call that body literacy. Embracing your body's natural rhythm encourages informed period care. It nurtures a more compassionate and connected relationship with yourself because like, okay, like this is a cycle. This is happening to all of us. You're not alone. Some people have harder symptoms than the other, but I think knowing in advance what is to come, then you can know, okay, this isn't the end of a crisis. Mm-hmm. Like this, preparing, knowing, being kind, gracious to yourself is helpful. And it's known to be helpful, but I love these things, just like, what's up with you down there? Like, what's going on? But there is so much, and you're going to see, there is so much things happening between the chemicals in your brain and your hormones. And it is a systemic thing. That's why I know it is confusing that you're like, what in the heck is going on? But it's a real flow. It is real. So knowing is very, very helpful. And probably to your partners, right? Because your partners are like, well, what's going on with you? And they're just kind of like, what's up with her? Knowing is helpful. Okay. Well, what do I push? That one. Okay. So again, cycle awareness. I kind of already said the why, because each phase has significant hormonal changes contributing to shifts in mood. Again, knowing what your body's experience can help you support yourself and avoid being caught off guard. Okay, so you're already going to know in advance. There are 4 phases. This is complicated, but when you can YouTube it and probably watch it 20 times and still be like, huh? Mm-hmm. But the gist is, we've got on our little stickers that I gave you. I know you can't necessarily see in all of them, but you'll see, like this is the uterus, which includes the fallopian tubes and then the ovaries on the side. So in the center is the endometrium, the endometrial cavity, which is where you've got your endometrial cycle. So there's a cycle going on with your ovaries, and there's a cycle going on with your endometrium, but they're overlapping and they're working at the same time. Okay. So here with the endometrial cycle, you see the endometrium is going to shed off, which is your period, right? That is day 1 of your period, starts this whole cycle. So I'll go through, do we have my little notes down below just so I don't miss, but that's okay.
Probably.
Essentially, phase 1 is the menstrual cycle. You start your period on day 1. You're going to look at, like, these hormones are showing you. Follicle stimulating hormone is a hormone that is going to go to the pituitary gland, and it's going to release gonadotropin hormone, and then it's going to tell your hypothalamus to then get ready for this luteinizing hormone. I mean, it is very complex, right? So also something that's not on here is testosterone. What's testosterone doing? I mean, just for a side plug, because I want you to understand, because some people think testosterone is just for males. There are more receptors on our body as females, on every part of our body, of testosterone, more than any other hormone. So isn't that interesting? Like, testosterone is important for us too. Anyway, I will try to stay on track. But in the beginning, these get really low. And so right before you start your period, right, like you may be feeling irritable, exhausted, moody. And then a lot of times, right, like you start your period, you do feel a little bit better. But all of these hormones, including estrogen, are starting to rise again in order to release an egg for ovulation. Okay. And so then within this endometrial cavity, our endometrium's getting nice and thick, ready for implantation. When we don't have a egg that is fertilized, then the body's like, I'm going to release. So all of these then plummet. Okay. This is usually about this ovulation phase. Sorry, look at me. I'm going off. Menstruation. Then we did the follicular phase, right? Where your ovary is working its way out to put out an egg. Then ovulation is about 14 days, but that is with an average of a 28-day cycle. And I just want to say out loud, because I see patients all the time and they're like, oh my gosh, I went 30 days and I never do that. Well, let me just say never say never. And you're an evolving human being, but that 28-day cycle is an average. So that means some people are cycling ovulating every 20 days. Some people are cycling every 35 days. So don't feel like you're off, you're wrong, you're not normal, because what is your normal is your normal. And it will fluctuate some depending on stress, depending on all kinds of things. So again, have grace for yourself. Anyway, so then the luteal phase is basically recovery, right? It's recovery. You didn't get pregnant, and now the endometrium builds again, okay? So usually around ovulation, all of your hormones start to increase, including testosterone, which is why you may notice like energy, even your sex drive will be up. I mean, your libido increases because you're probably, you're trying to make a baby. I mean, right. But all of those hormones make a big difference. Progesterone is a hormone that you have to keep a pregnancy. You have to have a surge in progesterone even to ovulate. And that is a calming hormone. So you may notice, like, there are times where why do you feel so chill? but then right before you feel like a psycho. You know what I mean? But sometimes you do. You just feel like, what in the world? Well, look, everything is plummeting, and then boom, you start your period, and it just starts over again. Some people don't have super hard symptoms. Some people do. Why is this so hard for me?
It's okay.
Okay. Oh, here it is.
Yeah.
So anyway, you guys can see that the follicular phase, there's increased energy, focus, ovulation, confidence, sociability. This is a nice way to say, like, maybe your libido goes up. Okay. Luteal, irritable, anxiety, low mood may occur.
Yeah. Okay. And so then I'm going to talk about how like all those hormones also affect the brain. So we'll start off by talking about the different hormones in the brain. Have you guys heard of serotonin and dopamine? No? Yes. Okay. All right. So serotonin is, like if you are depressed, that is one of the medications that they will give you is an SSRI. So it prevents you from reuptaking serotonin. And so it's produced in the brainstem, and actually 90% is actually in your gut, which was like news to me. So a lot of how like your digestive system works also affects how you feel, like in terms of your serotonin release. And that regulates your mood, emotional stability, sleep, appetite, anxiety, and overall sense of well-being. I'm just going to talk to you about these hormones, and then I'll go and talk about like how it connects to your
emotions.
The other hormones, the ovarian hormones, right?
Okay.
Is that what?
Yeah.
Yeah. Okay. Oh, and then we have dopamine, which is released by the prefrontal cortex. So it is in charge of focus, decision making, limbic system, emotion and reward, basal ganglia, motivation and movement, right? So it regulates motivation, reward, pleasure, focus, goal-directed behavior, and learning. If while listening to it, you already kind of see some similarities between like estrogen and how that helps boost mood, and then there's a connection with estrogen giving you energy as well. So these two are influenced by estrogen in some shape or form. And then we have GABA. It's a abbreviation for something I can't even pronounce, but it's produced by your limbic system, cortex, and amygdala. And it is the primary calming neurotransmitter. So when she mentioned progesterone being calming, so GABA works with progesterone to regulate your anxiety, to help you with calmness, emotional regulation, sleep, and relaxation. Who knows what cortisol is? Do we know what cortisol is? Okay, cortisol is our stress hormone, right? So it's released by our adrenaline glands, and it increases with stress, with lack of sleep, increases with anxiety, physical illness, and hormonal shifts. Okay, now we're gonna okay, so this is just like a summary, right? Serotonin, mood, sleep, emotional stability. When it's low, you get depression, irritability. Dopamine, motivation, focus, reward, right? If it is low, then you have low motivation and you're fatigued. GABA, it's responsible for calming, anxiety, regulation. When it's low, you have high anxiety and restlessness. And then we have cortisol, stress response and alertness. When it's low, that's good, right? But when it's high, anxiety and fatigue. All right. Okay. So how does this work together during the menstrual phase, right? Cycle. So first we have our menstruation. So the first 5 to 7 days of your period. So that your period is day 1 of your cycle usually. And so you will have low serotonin, you see, because your estrogen is low serotonin, low dopamine. And progesterone is low, so it's less GABA activity. And so you have lower stress tolerance as well, right? So you're more sensitive or reactive to stress or emotional triggers or activation. So the mental health effects during your menstrual phase is fatigue, low motivation, emotional sensitivity, low mood, you need rest, and maybe increased introspection. And that, in another word, is like maybe overthinking, right? So even a little bit, be like, why do they do that? Like, they probably hate me. And then you feel like like depressed or sad, and you're crying. And so that's normal, right? So this is why we're doing this, is to let you know that during your menstrual phase, it's so normal to feel fatigue. It's so normal to feel emotionally sensitive, right? So this is when you have to be kinder to yourself, right? And not be so hard on yourself. And I don't know if you guys have been seeing on TikTok, just like how if you're female and you're into like those working out TikToks, they talk about how you need to like notice your cycle and lift based on your cycle. During your menstrual phase, you're probably not going to lift as heavy as, let's say, during your ovulation phase. So being kinder to yourself and making those adjustments accordingly. Do you have anything to add to that?
No,
No?
it's all great.
And then we have our follicular phase. So that's right after our period is over, building up towards your ovulation. So you have increasing serotonin and dopamine. You can see the estrogen is increasing, and your progesterone is still stable, right? So your GABA activity is still stable. And then you notice your stress tolerance improving. Okay, so what that means is you're noticing improved mood. You're like feeling like increasing motivation, right? So better concentration, increased energy, creativity, right? Like I usually plan, like if I'm doing something really stressful, I try to keep it in this window. If not, I'm going to probably have a full meltdown. And so this is the time when you start to feel a little better, right? In terms of your mood, and you might be ready. Waking up, if you wake up early to go to the gym, you have more motivation to do that. Or if, like with school, you don't have as much difficulty focusing on schoolwork. That's another thing. Also, how it applies to your schoolwork, right? Knowing that. And then we have ovulation. That's when we feel like superwomen, right? So we have higher levels. There's a peak. So the highest level of serotonin and dopamine. And your GABA, the calming hormone, neurotransmitter is beginning to increase. And that's the point when you're at the highest stress resilience. So you have increased confidence, social engagement, or in other words, you feel frisky a lot more. You feel confident in your body, like you want to wear clothes that are probably a lot more, that help you feel good. You have positive mood, higher energy. I mean, all of this is creating, your body is preparing for you to have a baby. Essentially, that's what it comes down to. This menstrual phase is just revolving around having a baby. And then improved communication. Again, important when you want to have sex. So that is how that cycle affects your body. And then the last one. And I saw a meme about this, and it was pretty funny. It said, there was no baby, and so my ovaries are having a moment. And so that's what this looks like, right? Where it's upset that it didn't make a baby, and so it probably feels like it failed somehow, and so now it's having a moment. It's having a crash out. And so during the luteal phase, you have a decrease in serotonin and dopamine, so it's like plummets. Your GABA initially increases, like Brandy was mentioning, where you feel calm, and then you go, like she said, you go psycho. And it drops right before menstruation, and your stress sensitivity may increase, right? So what that looks like: irritability, increased anxiety, fatigue, brain fog. So if you have I would say if you have a big paper coming up, right, and the deadline is right around this portion, maybe don't wait till the last minute. Maybe plan to do it a little sooner, right? So that's one way in which that body awareness can help us be more successful and not lead us to a point of like a breakdown or a crash out, and lower stress tolerance. Yeah. So that's pretty much it for my end. And then I'll pass it on to Brandy again to talk about.
We thought we'd just mention some things, because everybody's heard of PMS or PMDD, The symptoms that we've said before are normal. I would not diagnose you with PMS, but I mean, like, this is a joke. I'm fine. I hate you. I love you. I want ice cream. Come here, get away, oranges. I mean, you're like, what is wrong? I'm so indecisive. But truly, that's pretty normal. Again, the hope is that once we give you this knowledge, you can then manage your responses a little bit better. But premenstrual syndrome is essentially these symptoms, but real heavy, more significantly so. Like your relationships are impacted greatly by it. Your work schedule, say you're having a call in, that then we're saying, this is not being managed well. So what can we do? Again, the premenstrual syndrome occurs in that luteal phase, like, right, the ovaries failed to have the baby and it's filling down. That's so cute. Okay. Yeah. Okay. Symptoms tend to obviously, right, like reoccur. If you're wondering, like, do I have PMS? If they are recurring in predictable patterns, probably so. But if it's manageable, then I wouldn't consider that to be PMS. Again, symptoms vary to slightly noticeable to very intense. It's estimated, though, that 3 out of 4 women experience some form of PMS. So see, like, you are not alone. Okay, emotional behavior, again, we've kind of said all of it, but again, this is just really more intense. Your tension and anxiety is a lot. Maybe you now you can reflect and be like, oh, I was ugly to my mom, every blah, blah, blah. Do you know what I mean? But also you're learning how to regulate your emotions. So again, that's what adulting is so fun for, because once you learn, then you can also learn how to respond. So that's part of what we hope that you get out of here. But again, like, you're having uncontrolled crying spells and you're like, I don't even know why I'm crying. Again, like, I have had patients where they're like having a crash out and they need a note for work. I mean, that is someone that is very dysregulated. We have work to do. We have a lot of work to do. If I have to write you a note for you to be out, then, you have PMS. But so again, food changes, right? Cravings can be crazy. You're going to see here in a minute how because we're giving you knowledge, I want you to remember that what you eat really does change how you feel. And so giving in to all the cravings, I would suggest resisting. Not always. I mean, we're all human. Okay. So physical symptoms. I mean, people can even have joint pain, muscle pain, right? Who has horrible cramps that like go all the way into your thighs? I mean, people have that. That is intense and makes you not want to work or go to school or, so headaches, fatigue, weight gain related to fluid retention, right? Usually
you feel bloated.
Yeah. And then that goes down. Breast tenderness, that is related to the increase in estrogen, which is totally normal. Even swelling is normal. And so, like, when I do my first well woman exams with my new patients who have never come, because we all know that that's like your favorite day, I like to educate people on like what's normal, what to expect, what not to expect, things that we think, when I'm like, this is the normal, don't worry about it. Because I have patients in all the time and they're worried about things that are totally normal. Anyway, which is why I love my job, because I get to educate. But I also tell people what is not normal, so that then, don't waste your time with anxiety you don't need. But so encourage everyone to get their exams so that we can educate even more. If you have any questions on that later, we can talk more. But, acne flares, constipation, or diarrhea is also very normal. Okay. Causes, I mean, when you look it up, it's like the exact cause is unknown. But obviously, it's a complex system. And really, it is all of these hormonal changes in the brain throughout the systemic system that is fluctuating and causes those changes in the way you feel. And then I will say that, like, if when you're pregnant, those symptoms go away because that's not happening. And the progesterone is very high to keep a pregnancy, so that is also
Calming.
kind of nice. I think that also contributes to why you go and think you want another baby, because you're so happy and you don't remember. Okay, and then menopause, all those symptoms go away, but then a whole new set of symptoms happen. And so I see that too. I just want to do a plug for all the older, for you in your future when you get there, because people are just like, oh my gosh, like I've always had a period like this, and it's always been, and I always tell people, but you've never been this years old. We're going into puberty in reverse. I mean, it is also like it's a trippy place. It's a trippy place. So, but we'll get through it together. I think the cool thing too is that the future is bright for postmenopausal women, and we are not going to let you suffer like your grandmas did. Okay. Chemical changes in the brain obviously are part of that. We talked about the serotonin in the brain. This is a neurotransmitter that it's crucial for your mood, and low chemical neurotransmission of serotonin is a super big trigger for that. That's why you will have some people on an SSRI. That serotonin, it actually encourages reuptake of serotonin. So you're trying to increase the serotonin to increase the mood. That's what that medicine does.
Okay.
So insufficient amounts of serotonin may contribute. Okay. I'm just going to say this real quick. There is also PMDD, which you will hear about, premenstrual dysphoric disorder. It's a severe form of PMS. These are people that are highly dysregulated. It is impacting their relationships. It's impacting their work, their school. That's pretty much all I'm going to say about that. If that is happening to you or a friend, you should really encourage that person to seek help, because that's hard to overcome.
Yeah. And PMDD is a little rarer than PMS, but then this is where making that referral, if you know a friend of yours is like really struggling around the time of that menstruation, then you want them to maybe seek help, and then they would be able to diagnose them with either PMDD or PMS. It might be one of the two, right? Okay. All right. I have a Kahoot. And so just to, we've been talking a bit, kind of to break it up and to get you guys. What happened to the screen? Why is there no signal?
Check out the smart device is connected.
There we go. It was good.
Who's a techie? Because I was like, bless you, it's not me. It's not me. I'm old school. I'll start drawing.
Wait, let me see. I guess the input. It's supposed to be.
HDMI 1.
Yeah, I did do
All of
that.
a sudden, it just said no signal.
Maybe it's disconnected on the back.
Or press the input button.
Yeah, I did do that. Okay, maybe I'll. Well, they don't. I guess it doesn't want you to play.
Play the Kahoot.
Yeah. That's weird. I'm wondering if it is back here, maybe. Did it work? Let's do HDMI 2 then. And then no. All right. Well, that's weird. Let me go back to my presentation. Maybe we'll like it then. Okay, while we're trying to figure this out, I do want you guys to maybe, if you have, we have an expert here, and, I want it to be anonymous because sometimes these questions can be difficult to ask out loud. But if you're comfortable asking out loud, go for it. But I want you guys to write some questions. And if you don't have any questions, put that on there, right? I want you to say, I don't have a question. But then I want everybody to put at least one piece of paper into this bowl. Oh, I have pens. While we're trying to figure this out.
Blessy, do you want me to go into like the treatment? You want me to flash forward or you want me to wait?
Yeah, you could. I mean, if you...
When we get to the slide, there are specific like suggestions for supplements that I have on there, but essentially the information is that, we're talking about neurotransmission, and in order to get the hormones where they need to go, you need that process to be healthy. And part of what we're seeing, and scientifically and pathophysiology wise, which is impacting how people treatment wise goes, is that when you really do focus on trying to eat healthy, trying to eat more like a Mediterranean-esque food, which I know is super hard in college, and doing all the things that you can do, which we know, routine exercise improves serotonin, trying to eat organically, making sure that you're getting good sleep. I have a 19-year-old, I have a freshman in college, so I get to see how he doesn't go to sleep till like 2 a.m. or 3. And I don't even know how he can function. But I think as a female, even more so, which I have a 15-year-old. So I'm always trying to tell her, how you're treating yourself matters. Mm-hmm. Are you sleeping? Are you getting routine exercise? Are you feeding yourself the things to help your cells regulate those neurotransmitters? It really does make an impact, like genuinely. And I have seen patients, I always say this, I always tell patients, I can't take patients where they don't want to go. But if I have a patient that is super motivated and will make those changes, I've truly seen some like turnarounds, and it's really cool, really, really cool to watch. So don't underestimate how you're treating yourself, please, please, please. And then, and there are some supplements I'll look on there because I listed them all. It's,
Yeah.
And then getting enough sleep. I can't say much, it's important. But also then there are some people that do need to do all of those things. They need to have a supportive family, someone to vent to, prayer, if that's your thing. I mean, whatever you need to do to help regulate yourself, you should put some effort towards that. And then there are patients, again, there are medications that we can treat with if you need, and that is okay too. And by the way, can I just say also that your health, privacy is important, and what you're going through, if you don't want to tell your friends how you're treating this, or you end up getting it on SSRI, because there is a lot of stigma with those. It's nobody's business. Mm-hmm. You have to do what's best for you. But I definitely would start with lifestyle changes first. Mm-hmm. Okay.
Yeah.
And this guys, I mean, you can, at the end, if you want to get a picture of this, but we know that vitamin B6, and I even have the milligrams on here, that improves mood. It reduces irritability and bloating. Calcium, 1,000 to 1,200 milligrams, reduces water retention, depressive symptoms, and food cravings. Magnesium eases cramping. Look, you needed to know all along. Thank you very much. So magnesium helps with cramping, headaches, aids in reducing anxiety, and the omega-3 helps reduce inflammation and menstrual cramps. But guys, also, I've had patients do like an anti-inflammatory diet, which is the Mediterranean diet. These people do amazing. Sometimes I've even had patients who, sometimes it's the products we're using. There are toxic chemicals in them. There is a brand called August. It's organic. And I've had like 3 different patients who have had significant symptoms. And the 2 that have bought into the story and changed their lifestyle and also changed their products, they've come back with, like, honestly, better symptom relief than I even expected. Okay, vitamin D reduces anxiety and irritability. Chasteberry, which is something new, and I had not known about it, but it apparently is often used for breast pain and irritability. And then these St. John's wort, 5-HTB, ginkgo biloba, these are things that improve and help uptake serotonin. But you have to take them consistently, like 4 weeks, 6 weeks, probably before you're ever going to see any improvement. So, some people are like, I threw that in the trash. I'm like, well, how many days did you take it? 3. Well, that's why it didn't work. Okay. And then obviously sometimes birth control is helpful, especially in young populations, because we're killing 2 birds with 1 stone. We're preventing unwanted pregnancies, and we are regulating those hormones so there's not so many fluctuations.
Yeah.
You want to go back to your Kahoot?
Do we want to do a Kahoot? Yeah. Yeah. Okay. Because I'm afraid that this is going to crash out on me again.
Oh no!
Okay.
Uh-oh.
Let's start. So take out your phones, and there should be. Let me see. You can hear there. Just about 8 questions. Just to break it up from the talking.
Are you breaking down? Are you breaking down?
I mean, if you have any questions, do you want to?
We need a guy. We need your opinions.
You have a question? Oh, here's the one. Oh, okay. If you have a question, could you have 1, 2, 3, 4? Okay, we have 7. Is there anyone online that needs to?
They haven't said it yet, but I put it in the chat if anybody wants to join it.
Okay, perfect. So I guess I'll give it another 15 seconds. Okay. All right. All right. So let me go ahead and start. Oh. All right. Oh. So it's a true or false. All right. So hormones may influence concentration and academic performance. All right. Good. Yay. All right, we have Dainara. Okay, next. I think I'm just gonna. PMS only includes physical symptoms. All right, good. We're learning something. All right, still Dainara on top. Mood changes during the menstrual cycle are just in your head.
What does it say?
I bite. We'll bite.
That's cute.
All right. Good. Next. Star. Taking over. Premenstrual dysphoric disorder is a recognized mental health condition. I don't know if we mentioned this, so we're all gonna. All right. Oh, look! Yay!
It is true. Yeah.
Yep. Mhm. All right. Next. Everyone experiences the same emotional symptoms during their menstrual cycle. Okay, so that's actually false, right? It varies based on people, like the genetic disposition and all those factors do influence what your symptoms would look like. Okay, cool. Next. Lifestyle factors like sleep, exercise, and nutrition can help manage symptoms. All right, true. Ooh, we have streaks too. Good job. Tracking your menstrual cycle can help you better understand mood and energy patterns. Oh, wow. Okay.
Woo.
Good.
Quick.
Yes. All right. Second to last. Severe emotional symptoms before a period are always normal and cannot be treated. This might be a tricky one. Maybe? Let's see. Okay, false. Good. They can be treated. All right. Star. And then last question. Hormones can influence anxiety, mood, and emotional sensitivity. All right. Okay, let's see. Let's see who got on the podium. Third place, we have Zeke. Ooh. We learned. Dianara. And who's on top? Star. I don't know which one. Star. Yay!
Yay! That was cute.
Good job. All right. Okay. Let me go back. Ooh, let me X out of it. Okay. Now let's go back to our PowerPoint. Did we? Let me do. Okay. Oh no. Yeah. What?
We just started making.
Oh, okay. Just start it over. Today is not my day. Okay, so we did go over the treatment considerations. So, did you want to add anything?
I don't think so.
Okay. And then key takeaways.
So our key takeaways, which I think you guys probably, if I just said, what are the key takeaways? The biggest thing is just
Any questions?
self-awareness and understanding what's happening to yourself.
Yeah, you're good.
And why you're having these mood fluctuations. When you recognize how you feel at different stages of the menstrual cycle, you can make informed decisions and make choices that benefit you and your body, right? So that you don't have to suffer. I mean, it really can be helpful. And sometimes it's just a matter of like knowing what this is. You know, this is not, you know, something else. This is these fluctuations. And so you can know and be reassured that everything really is okay. And again, do not underestimate the power of lifestyle changes and implementation. And then again, if you're having symptoms that you feel like are not well controlled, or you're feeling really, really, really down, and things are not going in the right direction for you, and you're trying those implementations and it's not working, then maybe there's something more going on and you should ask for help. Okay.
Yeah. Okay. So campus and community resources, of course, you have the ENMU Health and Wellness. If you are struggling with regulating your emotions and things of that nature, you can come meet with a licensed counselor on campus, or we also have Timely Care, right? So you can meet with a counselor on there, or even not specialized, but you can talk to a doctor through that. But we also have the Women's Health Clinic, and I love the RGH Women's Health Clinic. And so that's also a resource. So just calling and
Yeah,
making
I
an
work in
appointment.
the Clovis Clinic. We
Mhm.
also have a Clovis Clinic. So,
Yes.
yeah.
So yeah, Portales and Clovis. And then here are some educational resources if you want to learn more about these topics. And then cycle tracking tools, right? So that can be a good way to learn more about, because I mean, I remember when I went to my first women's health appointment, they were like, oh, do you use any cycle tracking tools? And they were asking for the reports of that. So that helps them be able to help you figure out what's going on and help, learn about the things that you probably don't know about, right? Okay. And then we have a bunch of questions.
Oh, we do?
Yes, we
Yeah.
do.
Okay.
All right.
You want to just like
Yeah,
divide and
I'll
conquer?
I mean,
Oh,
yes.
you guys are cute with your little tiny handwriting.
Do you want me to read it?
Maybe. I'm like going to get my readers.
I will read it. Okay, so I don't have any questions, but I wanted to say that it was really informative, and I got stuck with saying what we may. I got stuck with saying that we may experience breast tenderness because I experienced it, and now hearing that it is normal makes me feel a lot better.
Yes. And I'll
Yay.
just go on to say, because I have this all the time. If you have breast tenderness, specifically like right before your period, which is, or right before you're going to ovulate, when your estrogen goes up and it goes, the tenderness goes away, you know that it's estrogen, right? But and also, like, say you have an upper respiratory infection and you're like swollen, right? Your lymph nodes get swollen. Over time, gravity takes that. And so you may have swelling under here. You may feel like, oh my goodness, what is that? Again, and I always point this bone out in my body, like feel it, feel that bone. You feel how hard that is? There is no moving that bone. There's no mobility. When we feel lymph nodes, they're like spongy, they're mobile. When you are sore and sensitive because of estrogen, it's sore and sensitive, but there's nothing that feels like this, nothing. So if you ever have anything that does feel really hard and not mobile, that's weird. Now that's something to come in for sure. But if you're ever scared, bye guys, thanks for coming. If you're ever scared, come in so we can reassure you. But that will be helpful, because I see girls all the time that come in and I'm like, you're panicking for no reason,
Is menopause and midlife the same thing?
No. And this is so important because, I mean, I'm 48 and I have patients my age and older all the time. Nobody has a clue what menopause is, because no one has ever taught us. But so you're going to be empowered to know. Menopause is, you're going to hear perimenopause. That just means this is the time before menopause. So if I say postmenopause and menopause, that means that your ovarian function for your ovaries to put out an egg is now over. It's done. You've gone through puberty in reverse. And when does that happen? I wish we knew exactly, because then everyone could be prepared. The average age here in America is 50. But that means that there are some people at 42, 43, 44, 45 that are going through the change, right? There are people at 55, 56 that are still having periods and going through the change. But you do not reach menopause until you have not had a period for 1 year and 1 day. 360, if it's 364 days and you start your period, then I go, nope, you're not in menopause. So I'll give you an example. I had a 44-year-old come in just a couple years ago. She said, well, I think I'm in menopause. And I said, well, what makes you think that? And she said, well, I haven't had a period in 4 months. And I said, okay, well, let's do some labs and let's run a pregnancy test, because if you are having intercourse unprotected, you could be 50. She was pregnant.
Oh.
So it's just something to consider. It has to be a year and a day. Otherwise, if you don't want to get pregnant, you should probably protect yourself.
Yeah. Are hot flashes from when you're at menopause or at midlife?
I'm going to say that this is it can happen in perimenopause, which is the season before menopause, and that can be 10 years before. But for sure, a lot of again, it's variable. Like, I may have two sisters, and one of them has the worst hot flashes in all the land, and the other sister doesn't, and they're both in menopause. So, but most of the time it's in menopause because your estrogen level is at an all-time low because the system is no longer, you just don't have the hormone production like you did. So that's when it happens. And again, nowadays, hormone replacement therapy is going to be a standard of care. It is. It's going to be different from my mom, from my grandma. And so trying to help older women or women in their later years transition through that is a big part of my work, and I love it. Yeah, because it improves quality of life.
Yeah. No, absolutely. What is the best way for me to support my partner as they go through these stages?
That's a great question. I mean, I think one, like you having the knowledge is very, very helpful. And if your partner doesn't have the knowledge, helping your partner understand themselves, just so that you can support her and know, like, hey, I'm here for you, and what are your needs, and if the person is really struggling, maybe you can help them get the help they need.
Yeah. Absolutely.
And like exercise with them, encourage good foods, like live it with them.
Yeah. Does birth control affect this cycle in any way?
Sure. Yeah. I mean, it's purposely, remember the endometrial lining, right, is getting real thick for implantation. So birth control prevents the endometrial lining from getting thick. So there's not like a super big lining for implantation. That's another reason why oftentimes patients, if I have a patient who has terrible periods, they're painful, they're heavy, well, that's a great way to treat because the periods are more controlled. They're not so painful. The bleeding is not so extreme.
Yeah. So this one is one that you've kind of already addressed, but at what age does menopause start, and can it start early, like in your 30s or your 40s?
Again, average age is 50. So, but I will have some patients that come in and they're like, my mom went through menopause at 40. So then they're worried, right? Genetically, maybe they might go into it earlier, but I don't really see it,
Yeah. Okay. Can your menstrual cycle make your nose bleed? Is that connected?
No, that's not anything I've ever really learned. No.
Might be something else.
Oftentimes, most often here in this area, it is because it's extremely dry. And allergens are high, and you're just super dry. You're dehydrated. Moisturize the tissue of the nasal cavity with like Aquaphor. Make sure that you're hydrating. Usually, I think more than. Yeah.
How early can a girl get her period? Is age 9 too early to get your period?
No, I mean 9-year-olds do have periods. If you're 8 or under, it is like if you're starting to develop really pretty early, because from the start of breast development and then the stages of puberty, but once you get like breast buds and you've got some pubic hair, you've probably got about 2 years before you start your period. So that's a good way, like when you have kids, to know, right? Like, okay, like be prepared. Things are starting to develop. And so, 4th grade, 5th grade is really not that uncommon, especially among African American, Hispanic cultures. But I see it in young, any culture really. But yeah, it's not, I would say 8 or under is definitely abnormal. And hopefully the pediatrician's watching, right? Like if I had a 6-year-old that had pubic hair, I would go, maybe we need to do some testing because that shouldn't be happening yet.
The last question, is it normal to not be hungry on your period?
I think it's probably more normal to be ravenously hungry on your period, but no, that's okay. I mean, everyone, you know, you do you. Your normal is your normal. That's why we do have to like take that into consideration, because I'll have patients that come in and they compare themselves to everyone else. And just because your body's doing something a little bit different than everyone else does not mean that it's worrisome or concerning.
Yeah.
You know, so no, I think that's fine.
Yeah.
We
Well-
have a few questions online.
Oh, okay.
Okay.
All right, so this first one, it says, would our bodies still follow the menstrual cycle phases even without getting our period? For example, we would still get the ovulating phase, but our period didn't come that month because of stress.
That's a complicated question. Stress can do so much. Stress can change lots of things, and it really is a huge impact on what your cycles are doing. But I will have patients that may have you always want to make sure that your patient doesn't have a metabolic problem like PCOS or type 2 diabetes or something like that is causing them to have this infrequent, thank you for coming, infrequent period. But for instance, I'll have patients who are wanting to get pregnant and they may have a period and not ovulate. I can tell you if you're doing that depending on like what your progesterone level is. So, say someone's tried to get pregnant for a year and they're not, you want to make sure that their progesterone level is enough to sustain a pregnancy. And sometimes they're not. And you have to, there are medications we can help do that. But so did I answer the question? You may ovulate and not have your period. That is correct. Yes. So I don't, I want people to know that, because some people are like, well, I'm not having a period, so I can't get pregnant. Yes, you can. If you do not want to have a pregnancy, you should protect yourself.
All right, and then I believe that you guys spoke about this, but maybe this person missed it, but it says, what is dopamine?
What is dopamine? So dopamine is the neurotransmitter that is in charge of motivation and like a reward system. So it kind of helps you feel more motivated. Let me go back and make sure there's more to it. There. So it's in charge of motivation, focus, and reward. Yeah, so it helps with like concentration and things like that.
All right, and then the last question on the line, would starting your period early affect your mental health in your teen years?
No, not necessarily. There's lots of people who have started their period and have no mental health significance or struggle.
But then now the menstrual cycle, like if you are already diagnosed with like, let's say, depression or anxiety, like during those luteal phases, you will see like an exacerbation. So like an increase in those symptoms.
And also, again, this is another reason why we're saying knowledge is power, because I will say, when people start their period younger, maybe it caught their parent off guard and their parent was not able to give them anticipatory guidance. Part of this is like when you have kids, we know in every phase of every learning, if you give someone anticipatory guidance, they will typically do better through whatever they're going through. If you do not give your person, and we have a lot of people that may, their parent doesn't feel comfortable talking about it, so they just say nothing. And those kids probably do struggle a little bit more because they're alone and they don't know what is happening to them. It can be very scary.
Yeah.
Yes.
Can yours like change over the year? Because so at one point, like it was very irregular, so I only got it like every 3 months or something like that. But like now that I'm older, I get it like every month how you're supposed to.
Yes, that is super common. Also in the beginning, right, like this is an immature system that's just being developed, like your hypothalamus and everything's trying to connect. So like I will have parents bring their kids in at 12 and they're really, really concerned that their periods are irregular. They're only coming like every 4 months or whatever. And some providers will put those people on birth control. I do not. They need time. They need time to like get the system regulating, let it figure itself out. But yes, things can change. I mean, that is a large question, because sometimes like I'll see the reverse. You know, it's like my periods were normal, but because of metabolic changes, then things get out of whack. So it can happen both ways.
Does it have to last a week?
It does not have to. Really, you know, everyone is like, I mean, I'll have a lot of patients that they'll say, well, you have to have your period. You know, you only have to have about 3 to 4 periods a year to protect the endometrial lining from potential like endometrial cancer. So you don't have to have a period every single month. That's a myth.
Online question?
No more questions, but we have a few comments. From Ross, she says, "Thank you, ladies, for the presentation, and to Janaya for reaching out. Happy End of Women History Month."
Okay.
And then we have a comment from Samantha that says, "I would like to second that getting a good therapist, educating yourself, and lifestyle changes can make a world of a difference."
And yeah, going to
Cool.
yeah.
Thanks, everyone.
Any other questions based on this? No? Cool.
Actually,
you.
yes, it's 2.5 days normal.
Huh?
Is that normal? Like 2.5
2.5 days.
Yeah.
Oh, I mean, if that's your norm, then yes. You know, and let me just say this too, like, so people will go, I didn't have a period, and now this next month is atrocious and crazy, and you're like, what in the world? You've got to think about the pathophysiology. What is happening? Your endometrial lining is thickening, so you don't shed that off, it's going to be a beast. That next month is going to be a beast. And so, you know, I have patients and they're coming in, they're like, oh, and they're freaked out. And I'm like, well, I mean, I kind of expect that. Also this notion of, I mean, this might be too much information, but blood clots, right? People are like, and they'll bring pictures. They're like, look at this blood clot. And I love it. I'm like, cool, that looks like a regular blood clot. But like, if you put blood into a bowl, within 30 minutes, it's going to be clotted. So if you have something plugging the hole, and you pull that out, don't be surprised if you have clots. Now, if you are just bleeding through a tampon and a pad in 30 minutes and an hour, it's saturating your clothing, you're feeling weak. I mean, that's excessive. But, you know, again, once you kind of know, like, well, what does blood do? Blood does clot. I mean, if you set it in a bowl, it doesn't mean that you have a clotting disorder that's going, you know what I mean?
Yeah.
So,
I mean, I would say, like, if you do have those specific concerns, like maybe you haven't met with a women's health specialist, like that's probably something that's recommended. Like, I have a lot of students or clients that are afraid. I was afraid. You know, I was afraid of getting my pap smear done, you know, for the first time. And it took me, like, I remember somebody came, like, when I was a college student, I had a group of women that came up to me and were like, why haven't you, like, you're sexually active, like, why haven't you gotten your pap smear? And I was like, well, I didn't know it was like something I needed to get done. Yeah. And like, I made an appointment, and I was like, on the day of the appointment, I canceled it because I was like petrified, and I didn't have one till like a couple of years ago. Yeah. And so those are the things where, like, normalize. That's why we're having these conversations.
Right. I mean, we could have a whole topic about that, just because, even again, like, you know, people are like, I don't know, I think I had a pap. Well, there's a difference between a pelvic exam and a pap to me, but to the patient, they look the same. They look the same. But I mean, I love educating, and I have a large population of young females, and I feel like I always make it my goal for them at the end, which I feel like I have often. They're like, okay, that wasn't as bad as I thought it was going to be. And that's my goal for their appointments. Yeah. Again, 21 years of age is when we start our pap smear. But if you're sexually active, it's not painful. It's not difficult at all. But it's weird. I mean, odds could be
strange.
like, yes, okay, but we try to walk you through it, and really at the end of it, it's doable. And then if you are sexually active, but you're not yet 21, we still, depending on how many partners you have, you probably should at least come in once a year so we can do some testing and help you with birth control options if you're not on them. And yeah.
It's all about prevention.
Can you get hurt if you don't get one?
If you don't get a pap smear?
Yeah.
So the point of the pap smear is to look for abnormal cellular changes at the cervix. So human papillomavirus, HPV, is a virus that we know is transmitted through sexual activity. And men carry it too. So you can, give it back and forth. There's many different kinds of HPV, but the reason why what we know about HPV is there are certain types of HPV that can cause cervical cancer. They don't always, but they can. And so what we're doing is we're just looking for any abnormal changes so that we can monitor and make sure, right? I do always preference, when I'm educating young people and even my kids, one, there's an HPV vaccine, which is proven to help. Boys and girls can get it starting at age 12. I advocate for it. My spouse, when I got my kids the HPV vaccine, was like, "What are you doing?" And I'm like, listen, they're 12. I don't know who this guy's going to be. I want to protect his partners. I want to protect, because you've got to imagine, right? Just like when you all learned about HIV and all, hepatitis, even if that's your first person, if that person's been with 5 people, and then those 5 people were with 5 people apiece, I mean, do the math. You are exposed to all of that. That being said, HPV, not all types are worrisome. That's our job. That's what we're looking at. Cervical cancer, those cervical changes in the high-risk HPV kinds take a long time to develop. We're talking 20 to 30 years. So it's not anything that is super urgent, but that's what we're doing. That's why when you hear, get your pap smear every 3 to 5 years, yeah, you should.
Yeah.
This will be someone's next question. What if you've never had sex? Do you need to get your pap smear? You don't have the exposure to HPV, but you have to think it can be carried digitally, so
Digital.
so in other ways.
Okay.
Also, I've had patients who are waiting to have intercourse till marriage that have come in and said, well, I'm going to get married in June and I've never had a pap smear. Maybe she's 26. I personally, I'm like, get married and let me see you, next year after you've gotten married, because there's no need for me to try to put a speculum in this female and get a pap smear if she truly has had no sexual encounters, But there are some people who have not had intercourse and you're able to do the pap. It just depends. Again, I'm just there for the patient to try to facilitate. And then if we can, we can. And if we can't, we'll do it. We'll do it down the road.
Yeah.
Then we had one last comment or as a question actually from a husband. He says, I joined a bit late, but I want to understand how my wife feels during her period. I've read and heard that eating things that are high in iron help, but what else may help in terms of comfort?
During the period.
During the period. I mean, really anti-inflammatory diet altogether is very helpful. Consistently exercising is helpful. But yeah, foods high in iron will be helpful, especially if she has a really high flow. But staying hydrated, making sure that she's resting when she can. Did I answer that?
I think so, yeah.
But yeah, there's lots of stuff that you can look on the internet just for support to help, and that lifestyle modifications are really, really helpful. And your participation in that is so smart, and that's awesome.
Yeah. All right. Well, thank you, Brandy.
Absolutely.
And I wanted to. Okay. So that's Brandy's email, and she's in RGH in Clovis, or you can email me if you want like a portion of the slide, especially the treatment considerations and like the supplements, that I can send that to you guys. But yeah. Anything else? No.
Thanks,
All right.
guys.
Thank you, guys. Hopefully you learned something, and I actually share the knowledge, right?
Yeah,
Talk to your
share
friends
the
about
knowledge.
it, and like let them know, what you learned, and help them be empowered in their body too. All right.
Yay.